Bismillahirrahmanirrahim. As we have already uploaded a detailed videos about the seronegative spondyloarthropathies. Today we will talk and discuss MCQ about the topic of ankylosing spondylitis. These MCQs are taken from the very famous books MRCP and USMLE books. So question number 1. A 27-year-old male present with low back pain of 3-year duration. Pain is radiating to both the buttocks. Pain and stiffness is worse in the morning and gets better with activity. Examination show limited spine flexion. What is the most probable diagnosis? So this patient has inflammatory low back pain and limited spine flexion. So the most probable diagnosis is ankylosing spondylitis. But why the option A and the option B is incorrect? Because in mechanical low back pain and sprain of the lumbar ligament, the pain will increase with activity. But here the pain decrease with activity. So option A and option B is incorrect. Now look at the option D, rheumatoid arthritis. Rheumatoid arthritis does not cause the lower back pain. And option E, multiple myeloma. 27-year age is not a suitable age for the multiple myeloma. So the correct answer here is ankylosing spondylitis. Question number 2. Which of the following is positive in ankylosing spondylitis? Question option number A, rheumatoid factor. Option number B, anti-nuclear antibodies. And we know that rheumatoid factor and anti-nuclear antibodies are negative in ankylosing spondylitis. That is why ankylosing spondylitis are called the seronegative arthritis. Anti-Rho and anti-La is also negative in ankylosing spondylitis. It is positive in Sjogren's syndrome. HLA-DR4 is for the rheumatoid arthritis and not for the ankylosing spondylitis. So the correct answer here is option E, HLA-B27, which is positive in 90% of the cases of ankylosing spondylitis. But it is also positive in 10% of the normal population. HLA-B27 positive condition can be remembered by the mnemonic PEAR, P-E-A-R. P means psoriatic arthritis, E means enteropathic arthritis, A means ankylosing spondylitis, and R means reactive arthritis. Question number 3. A 28-year-old man is investigated for recurrent low back pain. A diagnosis of ankylosing spondylitis is suspected. Which one of the following investigation is most useful? ESR. ESR will be raised in any inflammatory condition, so this is not a useful investigation. X-ray of the sacroiliac joint is the first and most useful investigation to diagnose ankylosing spondylitis. But normal X-ray does not exclude the ankylosing spondylitis. So the correct answer here is option B. HLA-B27 will be positive in 90% of the cases, but it will be also positive in 10% of the normal population. CT of the lumbar spine and X-ray of the thoracic spine is not useful investigation for the ankylosing spondylitis. The correct answer here is X-ray of the sacroiliac joint, which is the first and most useful investigation for the ankylosing spondylitis. But if the X-ray of the sacroiliac joint is normal, you have to do the more sensitive and specific test, which is MRI of the sacroiliac joint. Question number 4. A 19-year-old man who is suffering from chronic low back pain and stiffness over both the hip. He says this is much worse in the morning, and he finds it difficult to get up and go to the work. He has also had an episode of left plantar fasciitis a month earlier. His father has ankylosing spondylitis. ESR and CRP is raised. X-ray of the sacroiliac joint is normal, or the lumbar spine is normal. Which of the following is most the best to confirm diagnosis of ankylosing spondylitis? So option A, NTCCP, which we know that NTCCP is for the rheumatoid arthritis, not for the ankylosing spondylitis. ESR will be raised in any inflammatory condition. HLA-B27 is positive in 90% of the cases of ankylosing spondylitis, but it is also positive in 10% of the normal population. So HLA-B27 does not exclude the ankylosing spondylitis. MRI of the sacroiliac joint is the best answer here, because MRI is the most sensitive and specific test for the ankylosing spondylitis. If the X-ray of the lumbosacral spine is normal, then the most sensitive and specific test is MRI of the lumbar spine or sacroiliac joint. It will show bone marrow edema and osteitis. Option E, ultrasound of the plantar surface of the feet. Yes, it will help in diagnosis the plantar fasciitis, but plantar fasciitis may occur in many other conditions. So the correct answer here is MRI of the sacroiliac joint. Question number 5. A 33-year-old man who is suspected of having ankylosing spondylitis has a lumbar spine X-ray. Which of the following feature is most likely to be present on X-ray? So we have already discussed the X-ray finding of the ankylosing spondylitis. That will show erosion, sclerosis, fusion of the lumbar vertebra, squaring of the lumbar vertebra, bamboo spine, which is a late presentation, and syndesmophyte, which is the ossification of the spinous ligament. So the correct answer here is option B, which is this sclerosis. Question number 6. A 24-year-old man who is investigated for chronic low back pain, which of the following would most suggest a diagnosis of ankylosing spondylitis? Option A, reduced lateral flexion of the lumbar spine. Pain gets worse during the day. Accentuated lumbar lordosis. Pain of straight leg raising test. Loss of thoracic kyphosis. So look at the option A, reduced lateral flexion of the lumbar spine. This is correct. Option B, pain gets worse during the day, and we know that pain improves during the day. Accentuated lumbar lordosis, but we know that there is loss of lumbar lordosis. Pain of straight leg raising test. This test is not done for the ankylosing spondylitis, but this test is actually done for the sciatica. And option E, loss of thoracic kyphosis. There is actually increase in thoracic kyphosis. So the correct answer here is option A, reduced lateral flexion of the lumbar spine. Question number 7. A 28-year-old man is diagnosed with having ankylosing spondylitis. Which of the following is the first line treatment? The first line treatment for ankylosing spondylitis is the exercise regime and the NSAIDs. All the other options are incorrect. A 22-year-old man with the diagnosis of ankylosing spondylitis is starting on ibuprofen. His symptoms are only partially improved with the regular ibuprofen, and he finds it difficult to hold down his job as electrician. X-ray of the sacroiliac joint reveals sacroiliitis. Which of the following is most appropriate next step? Azathioprine. Yes, it can be used as an adjunctive therapy, but not as a second line treatment. Golimumab. Golimumab may be used as a second line therapy, but before you have to do some other step. Methotrexate is not a good choice for the ankylosing spondylitis if the spine is involved. Naproxen. Yes, naproxen is a good choice here, because the first line treatment for the ankylosing spondylitis is the NSAID. If one NSAID is not working, you have to change it to another NSAID, different NSAID. When two different NSAIDs are not working, then you have to select the next up therapy, that is the anti-TNF. Prednisolone is not used in the ankylosing spondylitis because this will decrease the bone mineral density and will cause the osteoporosis. So the first line treatment is the NSAID. If one NSAID is not working, you have to try different NSAID, another NSAID. If two different NSAID are not working, then you have to go to the next level, that is second line therapy. Second line therapy, that is anti-TNF. Question number 9. A patient diagnosed 3 years ago with ankylosing spondylitis is complaining of peripheral joint pain. What is the treatment of choice for peripheral arthritis in ankylosing spondylitis? So the treatment of choice for peripheral arthritis in ankylosing spondylitis is the sulfasalazine, while all the other options are incorrect. Question number 10. A 10 patient is having chronic low back pain and stiffness and left eye discomfort. Sunlight bothers his eye. The low back pain increases at night and described as dull ache in the back and buttock area. Modified Schober test is part of. Pelvic X-ray shows sacroiliitis, which of the following is the most common extra-articular manifestation of ankylosing spondylitis. So the most common extra-articular manifestation of ankylosing spondylitis is the anterior uveitis. So the option B is the correct answer. And we know that there are 7 A's in the ankylosing spondylitis. The first A is for the anterior uveitis. Second A is for the apical lung fibrosis. Third A is for the AV block, that is atrioventricular block. Fourth A is for the aortic regurgitation. Fifth A is for the amyloidosis, and sixth A is the for the Achilles tendinitis, and 7A is for the end Quada equina syndrome and Quada equina syndrome. Question number 11. Which of the following is the most recognized complication in a patient with ankylosing spondylitis? That is, heart block is the correct answer, because look at the option B, aortic stenosis. Actually, there is aortic regurg, not in aortic stenosis. Achalasia, diabetes, and bronchiectasis does not occur in the ankylosing spondylitis. A 42-year-old male stumbled while getting out of his car and fell on his knee. He complained of severe back pain after the accident and pointed to his low back. He has a 20-year history of ankylosing spondylitis. Which of the following is the most likely cause of his current symptoms? When the question asks that this patient has ankylosing spondylitis for a very long time, and now he fall, and after fall he complained of severe low back pain. So what is your diagnosis? Muscle spasm. Option A is muscle spasm. Option B is for multiple myeloma. Option C is for the vertebral fracture. Option D is for the spinal root compression. And option E is for the peripheral visceral pain. So remember that the ankylosing spondylitis patient, the joints are fused. When the joint is not moving, the bone mineral density is decreased. This patient is osteoporotic, and a very minor trauma can cause fracture of the vertebra. So this is a vertebral fracture. The correct answer here is vertebral fracture. Question number 13. A 25-year-old man known case of ankylosing spondylitis tried different NSAID and physiotherapy for low back pain but remains symptomatic and asks you the potential benefit of anti-TNF. You should tell him that anti-TNF will improve all of the following except this patient has ankylosing spondylitis and he has tried different NSAID and physiotherapy, but this has not improved his symptoms and he is asking the benefit of anti-TNF therapy. So the question is asking that all of the following will improve with the anti-TNF therapy, but one thing will not improve. Which of the following will not improve with the anti-TNF? And that is radiological regression will not improve with the anti-TNF therapy, while all other will improve. So the correct answer here is radiological progression. This will not improve with the anti-TNF therapy. Question number 14. Which of the following statement about ankylosing spondylitis is correct? Schober test assists reduced chest expansion, and we know that Schober test is done to measure the spine mobility and not the chest expansion. So this is the incorrect. Option A is incorrect. HLA-B27 is positive in 50% of the patient of ankylosing spondylitis. This is also incorrect because we know that HLA-B27 is positive in 90% of the patient of ankylosing spondylitis. Option C, it is equally common in men and women, and we know that it is 3 times more common in men than in women. So this is also an incorrect option. Option D, the typical age of presentation is between 40 to 50 years of age. And we know that the typical age of presentation is 20 to 30 years of age, means younger age. So this is also an incorrect option. Option E, Achilles tendonitis is a recognized complication association. And we know that enthesitis is one of the association of ankylosing spondylitis. And the same one A, that is anterior uveitis, apical lung fibrosis, and the third one is the aortic regurgitation, AV block, amyloidosis, Achilles tendonitis. So Achilles tendonitis is correct here.